I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to talk about slap tear physical therapy exercises. So first of all, what's a slap tear? So a lot of overhead athletes, swimmers, volleyball players, people who do repetitive overhead motion are targeted people for slap tears. Not saying they're the only ones, but there are a lot of the people that get them. I have one in my right shoulder. So what is it? It is, so here's your bone right here. Here's your bone right here. So as your shoulder joint comes together, there's a labrum, and it's in here. So this humerus sits on that labrum, and what happens is that labrum can get torn, and when that labrum tears, you wind up with what we call a slap tear. And what happens is you get a lot of clicking, a lot of painful overhead motion. A lot of times what happens is people confuse a slap tear and impingement. A slap tear can lead to impingement. So these are two different things. So you want to be careful when you're talking about slap tears, whether you actually have a slap tear or you have a slap tear and impingement. The exercises are going to be somewhat similar. You want to make sure that the muscles are starting to stabilize the shoulder joint. So what happens with a slap tear is you generally will have a really loose capsule. So I was a swimmer my whole life, so I don't have a lot of stability in my shoulders. They are, I could dislocate this one pretty easily just with a pull down. So what I have to do is I have to keep the muscles strong around that shoulder because my capsule doesn't work as well. So the capsule is just like you picture saran wrap around your shoulder. That's what it is. It's basically this saran wrap that's around there. So because I've done this rotation probably 5 million times in my life, my capsule's a lot stretched out. So it's like this. So that head of that humerus is now moving around in there and not being held down. So I have to really keep my muscles a little bit stronger so it holds the head of that humerus in place and it doesn't grind on that labrum. So when you have a slap tear, a lot of times you're going to get some clicking. Now, this again, it could just be normal clicking, but a lot of times with overhead motion, you're going to get some clicking, some popping every time my arm goes overhead. You'll hear it, sometimes it'll be extremely loud. I don't actually like to move my arm in that manner for repetitive times because it does bother me. Do I need surgery? No. Am I going to get surgery? Absolutely not. A lot of people do choose to get this repaired. I don't play any overhead sports anymore. I know what's going to aggravate it, so I really try not to do those things in order to keep it calm. I can do anything that I want, basically just, I'm not going to do any intense overhead activities. But if you do have a slap tear and you choose not to get it operated on, or it's leading to impingement, which then can lead to a rotator cuff tear and this whole kind of snowball thing, there are some things that you can do at home in order to strengthen. So what you want to do is you want to strengthen everything basically around that area. So you want to make sure that you're strengthening the entire area around the shoulder. So a lot of people do, the bicep curls, which is fine, but your bicep is generally going to be irritated anyway. With a slap tear, it means you're really anterior, it means you're pulling forward. So you want to avoid a lot of the anterior motion when you're rehabbing or when you're doing exercises for a slap tear. This is generally all pretty strong. You can do nice and easy lateral raises. Okay, so one of the things that you want to be careful of is this is a lot of what happens when you have a slap tear or any sort of injury to your shoulder. You're going to do this. You're going to raise your shoulders up like this. You're going to use your upper trap in order to help you assist raise those. So it's really important that you do any type of motion in front of a mirror. I know some of these boutique gyms don't have mirrors in them, and it's really important that as you're doing, especially like a high intensity or like a fast repetition, that you're looking at yourself in the mirror, because that's when things start to do this. And it's not going to be something that you notice because your body's going to naturally do it. So you want to make sure that you are just doing this nice and easy without shrugging your shoulders. You may start with your arms bent. That's easier than having your arms straight out. But either way, you want to make sure that you're keeping your shoulders down. You can add weight to this to make this a little more challenging, all right? But you just want to go nice and easy. You want to make sure that you're going up and down nice and slow. That's going to help strengthen around that area. You want to do about 3 sets of 15. You're working more for endurance as opposed to strength because you want your muscles to be able to hold that shoulder in place a long time throughout the day. The next thing you want to do is you're going to do what we call external rotation. So if you have a band, you can tie it in a door over here, and you can pull it across your body. Okay? You can also doing this laying on your side, all right, and bring your arm up like this. Okay? Either way, it's this rotation outwards, all right, and you want to make sure that you have a little bit of resistance. If you're doing it standing, if you're doing it laying down on your side, you don't need as much resistance because gravity will actually do the work for you. A lot of times what I see in the gym is I see people doing this with this type of exercise. This is doing nothing but causing you back pain, okay? Everything should stay still, and you want to make sure you just rotate up and then down nice and slow, okay? Don't let gravity bring this arm down, all right? It's just nice and easy, okay? Again, if you have a band, you can attach it over here. The band goes in this hand and you pull it across. The elbow should stay close to the side of the body. You don't want to do this, where you're pulling that elbow away. That's not the motion. Elbow stays bent to 90 degrees, and you're just going to gently pull across. Nice and easy. Okay, again, you want to watch this shrugging motion, which I actually was just doing. So that way you're not, again, affecting anything in that area. The final thing you want to do is you want to do scap squeezes, okay? So you basically want to just squeeze your shoulder blades together. Now, you can do this with weights here, all right? You can do this laying on your stomach and have weights in your hands as you come out and do this. The main thing is that you are squeezing those shoulder blades together and you're doing it nice and slow. A lot of times at the gym, I'll see people with such heavy weight that they're just kind of throwing themselves back and really just getting a little bit of a shoulder pinch there. You want to make sure that you are squeezing and then going back down nice and easy, and squeezing and then going back down. All right? You don't have to hold it for any particular length of time, but just make sure it's not this. Okay? Squeeze and then back down. Squeeze and then back down. Start with no weight if you feel comfortable doing that. If not, you can do just soup cans in your kitchen where you're just coming up and squeezing and then going back down. That's 3 simple exercises that you're able to do at home if you have a slap tear or suspected slap tear, and you want to start to strengthen those areas around it. They're not designed to make you super sore, so you can do them every day. You start adding a lot of weight, you want to limit your time to, having that every other day rest in between, so that way you're not causing too much lactic acid buildup. Form is really important, especially with slap tears, especially with any type of shoulder injury. Your body's going to find a way to compensate. Compensation causes a ton of injuries. So make sure you're doing these in front of a mirror or having somebody watch you so you're not throwing your shoulders up like this or throwing yourself back, causing harm to your spine or your neck. If you are experiencing shoulder pain and you want to have a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.